Welcome again, and thank you for joining us. My name is Libby Oseguera, and I am the Executive Director of the Utah Developmental Disabilities Council. I'll be your moderator this evening. I'd like to thank the Utah Disability Advisory Network for organizing this opportunity for us to discuss this issue. Excuse me, the United States Department of Justice investigated Utah's disability service system, and the DOJ recently issued a letter that identified 3 primary findings, and those were access to employment and integrated options, specifically that people with intellectual and developmental disabilities are facing difficulties learning about and accessing community employment and integrated services. The second would be around provider support, and that the state's policies and funding make it difficult for providers to offer integrated services. And last, transition services. Utah's transition services for youth with intellectual and developmental disabilities are not coordinated, which leads to a lack of necessary support as they transition from school age to adulthood. Tonight, we will hear from a panel including Marianne Davies, a supervising attorney of the Disability Law Center, Cheryl Smith, past president of the Autism Council of Utah, and Matt Wappett, the executive director of the Utah State University Institute for Disability Research, Policy, and Practice. So this evening, we'll hear from each of our panelists, and they'll share some information about the investigation, the findings through their perspective, and then we'll address questions from the audience at the end. During this presentation from our panelists, if you have a question, we ask that you please hold it until after the presentation, or you can type it into the chat and we'll address it during the question and answer portion this evening. If you want to speak, everyone will be muted, so please raise your hand either physically or your little Zoom hand, and we will call on you when the time comes. To keep yourself anonymous, you can indicate that in the chat. We are going to be recording this event so that we can share it with those who are not able to attend today and are still curious about what happened in this conversation. So with that, we will go ahead and begin, and I would like to introduce Marianne Davies, and she will kick off our conversation. Take it away, Marianne.
Thank you. And it's nice to see so many people here tonight. And, just thank you to everyone for your interest in taking time out on a weeknight and taking time away from your families and your personal time to learn more about the DOJ findings letter. So this is not their findings letter. We did put out a fact sheet, and the findings letter is certainly available for review. So I am the attorney on the panel, but I don't want to, go through what I think the claims would be, because I'm not an attorney who's actually on this case or has constructed this case. But I did want to just provide some perspective about what I think these types of cases are trying to do, and how there are opportunities to make improvements in the service system and, help individuals get the supports that they need. So this is the findings letter is saying that the state is violating Title II of the Americans with Disabilities Act, which says segregation is a form of discrimination under the ADA. Segregation within the context of the ADA and case law has a specific meaning that, segregation means that people with disabilities, are unable to, receive services in the community. They're unable to participate in integrated activities and spend time with non-disabled peers. So that, at least in terms of how that has been applied nationally in cases, we've seen these type of Title II cases in prison systems and nursing homes, in private intermediate care facilities. So this type of case has been brought in a variety of contexts over several states. And here the DOJ is really looking at our service system in terms of how we provide services, employment services to people with disabilities. And I just want to note and highlight, this is not a findings letter that has to do with a provider or a type of provider. This is the type of investigation that looks at the service system as a whole, that looks at, you know, how somebody comes into learning about employment in school through getting supports with vocational rehab or with DSPD, the Division of Services for People with Disabilities, in terms of being able to work in the jobs that they want to. And I will say, you know, I want to just point out that it's looking at this whole, you know, service system, because certainly their findings letter touches on some of those pieces. And so I can tell you from my own experience representing clients where I have seen some issues for folks. You know, I've worked with clients who, you know, really wanted to, you know, get, you know, like I can think of a young client who wanted to get a job at a soda shop, but really wasn't getting enough support from Voc Rehab. And so their family just went out and helped them to do it on their own. You know, I have had folks who really needed, you know, a job coach to get and or keep a job. And because of internal policies from vocational rehab or DSPD, were unable to do so. And unfortunately, there have been times where I've seen people lose their jobs because of those policies. You know, I've also met with people who, you know, maybe they were working in a facility-based setting, but they really wanted to be able to, you know, go work. I had a client who really wanted to work in the mall, but, you know, between a couple of different agencies was told that's not an appropriate job goal for you. We're not going to support you to do that. And as a result, stayed in his facility-based setting, which he just really wanted to be able to work at the mall and, you know, interact with people and you know, get the, you know, be working in the same place anybody else would who doesn't have a disability. And so the, you know, the findings letter and the investigation, you know, I think what it's really kind of getting at are these different problems within the state, within the service system, the lack of coordination, you know, underfunding of certain services that make it really difficult for people to pursue community jobs, to learn about those at an early age, to create a job goal of their choosing, and then get the supportive services they need to be able to do jobs like that. So I hope that provides some more context about what these type of cases are looking at. You know, right now it's just a findings letter, so there's not a lawsuit. There's an attempt. What happens with the DOJ is they try and to have you know, settlement discussions with the state, and if they're able to do that, then litigation is avoided. But I do think this is also a time, you know, I think there probably, you know, big changes, or the idea of somebody else coming in, you know, can be quite nerve-wracking for people to not know what is going to come next. So what I do want to say is I think, you know, this is a really good time to be able to, you know, to be able to kind of provide feedback and voice certain things about, you know, what is or isn't working in the service system. And, you know, if you have, you know, if you think, hey, you know, I myself or my loved one really hasn't been able to do this job I want because of X policy or whatever, this is the time to say it. I think it's also a time not only to potentially really improve our service system, but get additional funding for services for people with disabilities and employment, and, you know, change. You know, the idea of change can be scary, but also can be a really good time to reflect on the things that maybe aren't working, and you know, have a real chance to improve upon those things. But I will leave it at that.
Thank you, Marianne. I appreciate those thoughts and comments. I'm going to go ahead and invite Cheryl to please share your perspective.
Hi, thanks for having me. So I represent the parents, and I probably don't represent every parent, but I know a lot of parents. In my particular situation, my son is very severely affected, and his disability looks really different from those, I'm going to say higher functioning, even though that's not appropriate anymore, individuals. So when this findings letter first came out, I think it's fair to say that the parents freaked out. I had a lot of calls and emails and texts about what does this mean for us? How is this going to affect my child? Are they going to shut down programs? I mean, how's this all going to work? And my friend Amberly asked me if I would have a one-on-one with the DOJ attorneys. So I was able to spend about an hour with them myself, and then again on another call. And we discussed, the findings letter and how that affected our population of folks with disabilities. And even when you read the findings, it says so many times in it, appropriate to the needs of the individual. So, in fact, they said, we are not here to shut down any provider. We are here to have a partnership with the providers and try to make things better. So we went over all the things that Marianne talked about, transition and voc rehab, and we haven't had a good experience with voc rehab. I'll just be frank about that. But again, my outcomes for my particular son, who is profoundly affected by autism, nonverbal with behaviors, look different than somebody who can voice, I would like to work at the mall and I would like to do this thing. It looks a lot different, right? I am all about his quality of life, not what he's going to get paid for that job, which looks different for people who want to get paid what other people get paid for doing the same job. And I get all of that. We talked about, I'm just trying to look at my notes here, but the excitement kind of from me was that there would be real personalized planning, individualized planning for people, and that things could improve. In fact, I hope they bring the hammer down, because this is a chance for us to get better services and better collaboration within our state. And we know that we need different rates for codes, and we need more collaboration within the departments of the state and all those things. So I'm actually excited for the findings letter. And, I know some of us have PTSD from some of the things that have happened in the past, and even settings that how they, settings came down, and that's a great thing for people, but how it's interpreted by the state looks different all the time. So we're just hoping to get that sort of understanding and collaboration. And I'm not worried about now this findings. I hope it's a good thing, and I hope it works out better. And I know that they understand that my guy is way different from a guy who can express his needs and wants. So thanks.
Thank you, Cheryl. Okay, Matthew, we're going to go ahead and turn it over to you, and please share your thoughts and perspectives.
Okay, well, thank you all, and thanks for the opportunity to share a few thoughts. I'll try to be as brief as I possibly can. But I do think it's important to note that this is based upon some interesting history. And the DOJ findings are very much in line with the work we've been trying to do since the 1970s with deinstitutionalization. As most of you probably know, prior to the mid-1970s, people with disabilities were largely absent from public life in our schools and in our communities. They often lived their entire lives in publicly funded asylums and institutions where they were out of sight and out of mind. And we found over the years, and this is one of the things I teach here at the university, is the history of disability, that these segregated settings that were out of sight, out of mind, were not safe places that protected people with disabilities. They often became warehouses for a population that society didn't want to deal with. Unfortunately, Utah, although we have moved the bar a little bit towards less segregation, we're still stuck in a very antiquated segregated care model that's more expensive, more resource intensive than newer community-based care models that ensure that people with disabilities have an opportunity to live, learn, work, and play within our communities and workplaces. I did my doctoral work here in Utah in the 1990s, and I left in 2000. And in the 1990s, I worked with the ARC, I worked with several other disability organizations. I left in 2000, and I came back in 2017 to work here at Utah State University. And in that time, I'd worked in several other Western states, Washington, Oregon, Alaska, Idaho. And I was shocked when I came back to Utah that although I'd seen significant change in the disability service systems in other states, that Utah hadn't changed much since the late 90s. And that's kind of been a consistent concern that I've seen. And it's something I believe that the DOJ highlights in their letter, that we're kind of stuck in an old system. We're stuck in a system that's not working. We're stuck in a system where people are isolated. Utah likes to think that it's family-centered and that it cares for its most vulnerable citizens, but the fact of the matter is that adults with disabilities are largely absent from public life in our workplaces and in our communities. And I think that this finding by the DOJ is a clear message to the state of Utah, letting them know that that is no longer acceptable, that the civil rights of individuals with disabilities are something that the state can and should do a better job at respecting and protecting. So anyway, I find this to be really a move in the right direction. Now, like everybody else has brought up, I know that the findings bring up a lot of fear. And that fear, I believe, is justified because the DOJ has done this in other states. Many of you probably know that this has happened in other states, and it's had mixed results. But the success of the changes in other states is dependent upon the investment by the state, by the community, by the families, and by the stakeholders who were involved in that process. That's why it's great that you're here, and that's why it's great that we all stay involved and participate in the process that is moving forward. Now, this is a process that's intended to improve services and not reduce them. That's been said before. Ideally, if this all plays out the way that it's supposed to, there should be more options and more choice and more freedom for individuals with disabilities than what they currently have. The intent is not to reduce services or to limit services at all, but to provide more flexibility and more options. So it's going to be a long process that will require changes across multiple systems. A lot of times people think, oh, it's just DSPD they're targeting. A lot of the issues brought up in the DOJ letter not just deal with DSPD, it deals with Medicaid, it deals with the Utah State Board of Education, it deals with vocational rehabilitation, it deals with transportation, right? And all of these systems are going to need to be involved in making the changes that are necessary to address the concerns outlined by the DOJ. As I mentioned, the changes needed will ideally result in more options for individuals with disabilities. It will result in more alternatives to guardianship. It will result in more job options. If you want to work in the community, that should be an option that's supported, and you should be able to do that while also still receiving day services. It will result in more community living options, right? If you want to live at home, if you want to live on your own, if you want to live in a group home, there should be more options for people to live in the community and to have the housing that they would like. It should result in more transportation options so that if people want to work, they have the ability to get to where they need to go. So in the end, I think that it's really important that you stay involved. Like I mentioned earlier, it's great that you're here. It's great that you're concerned. Please keep that concern close to your heart, because this is a process that's going to require courage. It's a process that's going to require patience. And it's a process that's going to require us to raise our voices and to make sure that the needs of our family members and the individuals that we care for are kept at the forefront of the change that is to come. So anyway, thank you. I appreciate the opportunity to share a few of my thoughts, and I think that's all I've got to say.
Thank you, Matt. I appreciate that. And I know everyone listening does as well. We are going to take a little bit of time and address any questions that you have. I know Aubrey sent a message into the chat, the group, that if you have a question, you can do so with the chat or the Q&A function. You can raise your hand, however you want to indicate that you have something to say. Well, we did get a comment that came in that I would like to share. And this comment comes from Lisa, and she says that my read of the letter was that it was great for folks with disabilities. I immediately reached out to my state legislators and encouraged them to get involved in working with the disability community to expand services to meet the DOJ's expectations and federal legal requirements. The most exciting finding for my family was the push to reduce the DSPD wait time. So, thank you. Anyone else have a thought or something that they would like to share? Cheryl, your hand is up. Yes, please.
I just forgot to say one thing. When I was having these discussions with the DOJ, it's also important to me as a parent that, you know, when I prepare my adult child to go out into the world and be safe in the community and maybe get employment and go to the day program and have choice, I need the community to be ready to take him. So part of that whole process is what are our incentives for the community to employ our guys and gals and to accept them and to make them safe in the community. So that to me is another piece of the puzzle.
Thank you for sharing that. Marianne, you came off mute. Did you have something you wanted to say?
Oh, yeah, just, just to build on what Cheryl said, I think, that's absolutely a, very good point and concern. I will also use that as a chance to just plug our employment services at the Disability Law Center. So I'm on our employment team, and we actually do litigate cases of employment discrimination. I certainly don't want to say, put fear into people and say, hey, you really have to worry about employment discrimination. I think there's many good places to work, and I've done a lot of work with employers myself in terms of talking about, how we can be more accommodating, how some of the changes of the pandemic have really expanded opportunities for people with disabilities. And actually, just building on that, we saw people coming out of COVID, people with disabilities actually having a much quicker rebound in terms of jobs and expanding their participation in the workplace because of changes from the pandemic. So I think there are hopeful things out there, but also, if you do have you yourself or your loved one, is working and, you're not sure about reasonable accommodations, you fear that maybe you're going to be terminated because of your disability or you're not getting things that you need. The Disability Law Center on our website, we do have lots of videos about reasonable accommodations. We do take cases of employment discrimination, and there's also some really great resources out there like askjan.org, which has a whole list of suggested accommodations by disability, by job function. So there's a lot of stuff out there. And I will say I've at least seen, there's certainly always going to be some problems. There always are. Attorneys won't go away because of these things, but I think there are a lot of things to be hopeful about. I see a lot of employers, doing good things and looking at how to incorporate people with disabilities in the workplace in a really, in a really helpful way.
Thank you, Marianne. I think I'll take this opportunity to just ask our panelists, what can we expect next in the process?
Yeah, I mean, I think like I said, I mean, I think, the the DOJ does have another listening session coming up. I think probably Amberly knows that date better than I do, about that will be focused more on things like transition. And I think they're still looking to gather feedback and, get in touch with individuals. They will be, there's a little bit of a difference. So like if between a DOJ bringing the case and a private plaintiff. So if it was a private plaintiff, you would actually have to file litigation and then move into settlement discussions with the DOJ. They issue these findings letter and then see if they can come to a resolution with the state. So I think they will be working, one-on-one with the state to talk about the problems and see if the parties can come to a settlement that would resolve the violations that the DOJ has found. If that process would not be successful, then the DOJ would have the opportunity to initiate litigation in court. I do not expect any of those settlement discussions will be open. These are discussions that are kind of like pre-litigation discussions. But I do think one thing that you absolutely can do is provide feedback to the Department of Justice. They have made their information public so that if you have, an area of concern, or if you feel like this is a really important barrier in the system that you should know about, I think you can absolutely forward that to them. I think this is a good opportunity to provide them with information that would be helpful for them to, understand what are the problems or changes that need to be made in the system, that would be more supportive of people being able to work jobs in the community and get the supports they need to do that.
Thank you. I see that Dick has his hand raised, and if someone with better tech skills can please unmute him. Thank you.
Can you hear me?
We can, yes, please go ahead.
Oh, okay. Well, my name's Dick Bear. Currently, I'm a provider in Brigham City. Before that, I worked for it's Matt's program. It was called the Center for Persons with Disabilities when I worked there for about 40 years. Which is to say I'm old and I've been around and I've seen a lot in the disability service system. I can tell you that for decades, DSPD gave the message to people with disabilities that they could choose to do whatever they want. They could choose to work in the community. They could choose to go to day training programs. They could choose respite. And that was all managed through a person-centered planning process. And at least in our program, that seemed to work pretty well. All right. People would come in and they would get together with their family, their support coordinator, their provider, their doctor, whoever they wanted to have involved. And that group would decide on what's the best program for that individual. Then the settings thing came along and we were asked for public input. Our families got together and put together a petition, and they focused on two things. They said, one, preserve the spectrum of services, okay? Because there was discussion at the time, we don't want supported employment, we don't want this, we don't want that. But our families said, no, we want the entire spectrum of services, all right? So that we can fit our individuals into the services that they need. So that was one thing that came up. The other thing that came up was that they wanted consumer and family choice to be an emphasis. In other words, they didn't want the settings people coming into the state of Utah or any other state and telling everybody, look, everybody should be employed in the community. Everybody should do this, everybody should do that. They wanted that decision to be left to the family and the person with a disability. So that was our input, and I still have that petition and all the signatures and the language, and if anybody's interested in seeing it, I would be happy to share it with them. Then we had, I don't know how many years of working on the settings rule. with great push to get people into the community and great push to get people employed. And on the surface, that looks great. Okay, and for many, many people, that's a desirable goal. But some not so good things came out of it. We had, well, DSPD wrote their rules so that you couldn't be employed by us as a provider and employed in the community. And we had clients who had both types of employment. And as that rule came into effect, we were going to have to say to our clients, okay, we're taking this job away from you. You can't work there anymore. Okay, and those were the ones that we had found that we basically contracted to clean the bathrooms in the building that we were in. But as a result of that, all right, we had people who lost their jobs. We lost the contract. We lost a community employer, and our rent went up by 50%. Okay. Now, nobody intended this to happen to us, but we told DSPD ahead of time that this is where we're going. So that was one thing. And it hurt our program, but more than that, it hurt our clients. I mean, they had just less income and so forth. So that's one thing. The other thing we find is that we can get people employed in the community or in sheltered work. And I think that should remain to be an option. But it only takes up part of their day. Okay, we can't get them employed. Many of them we can't get employed full time so that it takes up a large portion of their day. Well, for that portion of their day, we can spend part of the time going to the movies. We can spend part of the time going out to eat. We can spend part of the time in the community garden. But there is time, all right, that just needs to be filled. And we find that the best way to fill that time is to have our day training program and a place for people to go. And then that allows their families to not have to be home to take care of them. So there's that issue. So I can go on for a long time, but one of the things that's coming out for me, I think we need to re-emphasize the person-centered planning process. And we need to have a broad spectrum of services and recognize that it's the individual and their families that should primarily determine which of those services they want, not people in Washington, not people in the state offices. And I'll let it go at that. Thank you for listening.
Thank you, Dick. I appreciate those comments. We will be sharing at the end of this a contact for somebody at the DOJ if you want to share the things that you expressed to us. I'll let the panelists have an opportunity. Does anyone want to respond to Dick's comments? And if there's nothing more to say on that, I will move to the next question.
I can respond briefly. I mean, I think you bring up some very valid points, Dick, and I think the one thing to note in the DOJ thing, and the thing that they point out several times, is that right now in Utah, people don't have choice. They're not presented with choice. They're kind of sent down a one-way road. And the one thing that they're saying is that our system needs to be redesigned in a way where people actually have truly legitimate choice. I would totally agree. I don't think that the person-centered plan is the center of what happens now. And in fact, I don't think that it's necessarily even implemented as successfully as it could or should be. And so I totally agree with you. I mean, the DOJ, I think, is pointing that out too. There's nothing in the letter that says that they're going to shut down choice. It says, right, we've got to provide more options. We've got to provide more flexibility. We've got to provide more opportunities so that, yeah, if people want to go to a day program, they can go to a day program. But if they want to go to a day program and work part of the day, they can do that too. And so, yeah, I mean, the problem is right now is that this isn't just a DSPD thing. This is a systems thing. And And, you know, the minute you touch one part of the system, you've got to mess with the other part and the other part and the other part. And so it is going to be there are going to be some unintended consequences, I'm sure, but the hope is, right, that in the end, that we are going to get to a place where the person-centered plan is the focus of what the services are, and that people have genuine choice about where they want to be, where they want to get their services, and what they want to do with their time. So I'll leave it at that.
Thank you, Matt. We've got a question coming in from Liz, and she says, several states have started investing in inclusive college and other post-secondary education programs as a way to improve employment and independent living outcomes. Is that something on the table here? We have 3 such programs in the state and 3 other institutions of higher education interested in starting programs.
I think at least legally in terms of like what is or isn't on the table in terms of a settlement, I think what you can kind of push for this things within the state's control, and certainly in the 3 entities that I think are the main you know, that if this were a lawsuit would be the defendant. So I think you have Department of Health and Human Services, vocational rehab, and the Utah State Board of Education. I don't think those folks would have any control over necessarily the development of educational programs geared towards people with disabilities, but I think that is certainly something that is a very good community discussion to be having and pushing, and to continue to push our agencies and our legislature, because you know so many of our systems of higher education are within the you know do fall under you know the funding and direction of the legislature. So I think that's a very good place to say we need to see more investments in these type of services in our system of higher education. I also just think that in terms of like how you could see this play out, or something that is very important for the DOJ to be thinking about in terms of how do we get folks actually connected to those. You know, I see this come up a lot with clients who are working with vocational rehabilitation, and how it can really be difficult to get voc rehab to pay for school, to let people know about school as an option, to let people know about you know, how VR actually can pay for you to go to college, can pay for you to get training and things like that. So I think that is, you know, if you had those experiences, you know, I think that's certainly very good feedback to share. I mean, I think it's something, you know, we would certainly like the DOJ to know about as well, just from the clients we see, because I think that is such a good, valuable resource from voc rehab to be able to get connected to those services. But we do see problems within their system of, one, letting people know about it. 2, I have found that, you know, if you are someone with maybe like if you are someone who isn't necessarily if you don't know the process well enough, you may not be able to get connected to those services, because, you know, within voc rehab, sometimes they won't even tell you about the services that are available, so you wouldn't even know to ask for them. So I think having some more proactive response from voc rehab to really go over the services and things that can be provided. I guess I hope that is responsive to that individual's question. But I think those are the areas where, in terms of like a direct tie to settlement, I think you could definitely see more about that within USBE in terms of talking about educational, you know, post-secondary opportunities with kiddos at a young age, and getting them prepared and getting them ready to apply. And then also within voc rehab in terms of actually paying for those services and letting people know they exist.
Thank you, Marianne. Okay, we're coming to the end of our time, so I think we'll just ask our panelists if they just have any final word or final thoughts that they'd like to share, and then we'll probably end for the evening.
I will just chime in and say, you know what? I love that you're all on here. And as a parent advocate, I hope when it's time to go and push for change and use this as a backdrop for the conduit to change, that you're all willing to talk to your legislators, like Lisa had said, and people that can help us make a difference, because it takes a village. And I know that we're all different. Like I said, I love that they want to make it for individual choice, and that's always what we want, but that's not always what we get. Some of the things that come down the pipe, you know, my kid doesn't want to do. He doesn't want to go out in the community. He doesn't want to do things that other people with disabilities want to do. So like my husband says, in the car business, there's a butt for every seat. Somebody is going to buy that fluorescent orange Jeep, you know they are, or whatever, because everyone's different and everyone has different needs. So I hope we can all rally together to make it happen. Thanks for your support.
Thank you, Cheryl. Matt or Marianne, Marianne, go ahead.
Oh, sure. Yeah, well, and I don't know, Libby, are we scheduled to go until 8? I was going to say, I can share some thoughts, but I'm certainly
Yeah.
happy to stay on and answer questions if anything else comes up. But I think what I would just like to share is, I spend a lot of time working directly with clients. It's one of the things that I like a lot about my job, and I spend a lot of times in facilities with people. I spend a lot of time working with clients who are trying to get services that they have a hard time doing. And I think what I have seen about our service system in terms of employment for people with disabilities is that there's a lot of roadblock blocks that are set up. If you want to go into like if you want to go, like I said, even get a job at the mall, that can be really hard within our state service system. We see it at an early age, kiddos and their families really not learning about transition services and how those can be really meaningful. We see those transition services not resulting in very good career paths or even, helpful job discussions. I'll see people who get into working with a voc rehab counselor, and when they say, what I would really love to do, I'd love to be an art teacher, are told, what I think would be a better career path for you to be a janitor or to, work at a call center, things that are, clearly not their job goal in any way. And then, we see people waiting for years and years to get into DSPD services and then, have a really hard time getting from VR over to DSPD and not having like a big gap in services and not being able to get their job coach, and because of that, they lose their job. So I think, in terms of the DOJ's findings letter, I think what they're really trying to get at is that there are a lot of problems within our service system and a lot of problems that make it really challenging, for people to, get a job, at a place of their choosing and get a job where, they feel like they're being fulfilled in terms of their interests and who they want to be around. And so I think that's really what, this findings letter is getting at. Like I said, I think there's always certainly uncertainty. I know there was a lot of uncertainty around, the settings rule, although I will say that really was implemented on a state level. And I will also say the settings rule is not the same as Title II of the ADA. Those are different things. So I just want to make sure that folks are aware, that we're not talking about some sort of, settings rule part 2, but the compliance with the Americans with Disabilities Act is separate and distinct. So I think this is, I think one of the things about my organization that I love best is to help people with disabilities really be the people that they want to be, to live the lives that they want and, to have, meaningful choice, just as anybody else would. And I'm hopeful that the findings letter is really looking at how to close those gaps so that you don't have to fight so hard from day one, that you don't have to be pushing back on every single person in the service system saying, hey, you know what, I do want to, you know, take this path. You know, like I said, my client who wanted to work at the mall, he was told that wasn't appropriate because he wanted a discount at a certain store. And I think that is a perfectly good reason to want a job somewhere, but somebody else made a decision about his capability and what it was appropriate for him just because he had a disability. And so I want that to change for folks. I want that to, I want everybody to be able to, lead their own lives and say, hey, this is where I go to work every day and I feel really good about it. So I am hopeful that those are the type of changes that we will see. I'm hopeful that we will have improvements in our service system. And I'm very hopeful that there's going to be a lot more choices and opportunities for people with disabilities.
Thank you, Marianne. We did get another question come in that is perfect because I think it's a great way to end with some kind of call to action. The question is, in addition to contacting our legislators, how do we help to make this happen? So go ahead, panelists. How can people get involved and make some changes that we want to see to our systems?
I'll jump in here. I think the first one, and this has come up on a few of the questions today, would be to take the opportunity to talk to the DOJ when they come out in August to talk about transition and some of the issues there. And they will be coming out and there will be opportunities, like Marianne and others have pointed out, to have your voice heard and to express your concerns. So I would say, one very easy, quick one is just once we have the dates for those August meetings when the DOJ will be out here, we'll get those out and make sure that you show up and share your concerns. That's a really easy one, but I know Marianne probably has a few others, so. Yeah.
I do not do our legislative work in any way, but so I will kick that over to Cheryl because I know
Okay.
you work with Nate and are so wonderful at that. So.
Well, and it's hard to know right now because we don't know what the state is going to do with the findings. So, what would be maybe helpful even as those who want to advocate and help, send me an email on the Autism Council of Utah website, and I can let you know sort of our grassroots efforts as parents and providers that we might be doing. Or you, Dan, can put out something when we get more information. I don't know this, but I think because you signed up, we have your emails and we can kind of let you know the direction that we're going to go to advocate. Right now, I don't really know what the state's going to say back, so it's hard for me to say.
Thank you. Okay, so this was some really great information, and I appreciate not only our panelists, but again, you, Dan, for organizing this, and for all of you who are in attendance today to help improve our systems. So as mentioned, there's some other events coming up, and we'll make sure that we share that information with you as we are made aware of it. And we also did put some contact information for a person we've been working with at the DOJ, Victoria Thomas. So if you want to reach out to them directly, that would be great. And Aubrey raised her hand. I will let Aubrey say something.
Yeah, sorry, I just am wanting to make sure to add in just a couple of things. If everyone is okay with it, we will go ahead and let folks know when the DOJ is coming out and how to get involved in that, maybe through the listserv as people signed up for this, if that's okay with everyone. And then I also have a question in the comments on if the state's response will be public. And it's my understanding it will not be, but I also want to make sure that I give that over to the panelists.
I don't think that will be a public document. I think that's a document that is pre-litigation and as an attorney, you do have certain rules around confidentiality and things like that when it comes to litigation. You could certainly attempt to request that through grandma, but I think the state would probably deny it, but you never know. So you give it a try.
Hi, this is Chris Larson. I know that there has been some success with others getting that request or getting that response. So it's worth asking if anybody's interested.
Thank you, Chris. Okay. Well, I think I don't see any other questions coming in. And I guess we'll be in touch if everyone's okay with that. So again, I appreciate everyone sharing their evening, and it was nice seeing everyone. We'll be in touch. Thank you again for joining us, and good night.